if you detect dementia early on, what are the options now from a very high level?
So it's a great question. There is a non-pharmacological treatment, meaning there's things that you can do without medication that actually can help train their memory and slow down the progress. And always we start with early detection. Like there are certain screening tools that primary care physicians, internists can do in their practice where patients are okay, but they can respond to those questions and give you a score for how bad is their cognition. And it depends on their score. You can start some non-pharmacological treatment. It starts with just, if they're not hearing well, you can just provide a hearing aid, or they're not seeing well, you can give them the right prescription for their glasses, because the sensory feeling is something that affects dementia big time. So if I start medical treatment and I don't pay attention to
some basic stuff.
The basic stuff, they're not actually...
So they're not seeing, they're not hearing the way they should, so the inputs aren't right, so they get worse, because if you're not getting your inputs, how are you developing, right? Absolutely. They get kind of the opposite of, a young child is, if they don't get inputs, they don't develop.
Exactly. So you want to make sure first there are reversible things that you can help and easily fix. Mobility. You want to make sure they're hydrated well. They make sure they're getting enough nutrition. You want to make sure that they're up, walking. They don't need a walker. They don't need a cane. The home safety.
Basic movement exercise.
Yeah, basic movement.
Like these things, that they're not too isolated.
So it requires a multidisciplinary approach where you involve physical therapy. You want to involve dietitian. You want to make sure they get their vision and hearing checked every year. After you're done with all of that, and if they still... You bring them back to the office and you do that screening test again. And if they do better, that's great. Keep doing what you're doing.
Yeah.
You don't need to start treatment, actually. If they're getting worse, then you can start a lot of treatment at this point.